Good day, Polinians. How are you and your families currently? I am grateful to have this opportunity to speak before you of what is really happening around the world in celebration of SciMath Month with the theme Responding to COVID-19 Pandemic Through Math and Science. But before I talk to you too much, let me ask you, when was the last time you were with your classmates and friends having fun? Do you miss those happenings? Well, what is the main reason why you cannot do it at this time? Yes, I heard you right. It is the pandemic that hinders us to live what life we used to have. Can you still remember when and how this pandemic started? Let us have a throwback. Coronaviruses are important human and animal pathogens. At the end of 2019, a novel coronavirus was identified as the cause of a cluster of pneumonia cases in Wuhan, a city in the Hubei province of China. It rapidly spread, resulting in an epidemic throughout China, followed by an increasing number of cases in other countries throughout the world. In February 2020, the World Health Organization designated the disease COVID-19, which stands for Coronavirus Disease 2019. The virus that causes COVID-19 is designated severe acute respiratory syndrome, which also affected millions of people, including us, Filipinos. For many months have passed. What have you done, at least to lessen the impact to yourself and your loved ones? At this hour, I am overwhelmed to introduce to all of you our guest speaker. We are all blessed to have someone who is a frontliner herself, who is more than willing to share with us her own first-hand experience seeing people suffering from this killer virus. She is presently practicing her craft as retainer dentist at Makati Medical Center Health Hub, where she started on August 22, 2013. She is also a private dentist specialized in orthodontic and minor oral surgery in Barangay Kasilawan, Makati City, where her family resides, and in Parañaque City. Way back the years before she entered in Makati Medical Center, she graduated at Centro Escolar University College of Dentistry with a degree of Doctor in Dental Medicine in October 1995 and in the same school with a degree of Associate in Arts Pre-Dentistry in April 1991. She also served as intern at 1300 Paris Dental Dispensary Philippine Air Force Villamor Air Base, Pasay City from March to June 1996. In addition, she accepted to serve as a barangay dentist in Barangay Baclaran, Parañaque City from 1998 to 2018. She attended countless of professional development trainings, lectures, and seminars that made her expert and efficient dentist. Membership and affiliations to many different dental associations made her popular and easy to communicate. Not to forget, she is also one of our incredibly supportive parents in SPC Makati, the reason why I have known her for quite some time. Her two sons were my students in grade school. I passionately believe that she can give us a clear view of what and how this pandemic affects our lives. Without further ado, let us welcome Dr. Agnes Alys F. Hernandez with a round of applause.
Good day and peace be with you. I am a dentist by profession and I have two private clinics, one in Sukat and one here in Makati. I am also a retainer dentist for Makati Medical Center, and in my private practice, I have to follow a new norm which is recommended by the Department of Health. Patients come in by appointment and dentists have to wear personal protective gears. Before I begin, I would like to put a disclaimer. I am not an expert on the topic, and I would just like to share what I know from my experience being a COVID patient. Our topic for today is responding to COVID-19 pandemic using math and science. Okay, let's start. The term coronavirus refers to a large group of viruses known to affect birds and mammals, including humans. Coronaviruses are named for the spiky projections on their surface. Family of coronaviruses known to affect humans are common cold, severe acute respiratory syndrome or SARS, Middle East respiratory syndrome or MERS, and the nCoV 2019, which was identified as the cause of the disease outbreak that originated in Wuhan, China. The virus is known as Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2. The disease it causes is called Coronavirus Disease 2019 or COVID-19. It is spread through respiratory droplets released when someone with the virus coughs, sneezes, or talks. The World Health Organization declared COVID-19 outbreak a pandemic last March 2020. Okay. What is the difference between virus and bacteria? Viruses are like the common cold or influenza, are not alive and must invade living cells to grow. The body's own immune system must fight off the virus and let it run its course. Viral infection are usually accompanied by multiple symptoms such as sore throat, runny nose, congestion, vomiting, and diarrhea, while bacteria is a living organism and can be found everywhere. There are times when the body's immune system may not be able to fight off a bacterial infection. Antibiotics work to kill the bacteria by stopping its growth. Bacterial infection often go together with pain, aches, or sore areas of the body. I repeat, the virus are not alive and must invade living cells, while the bacteria are living organisms. Both viral and bacterial infection are spread the same way through sneezing, coughing, talking. Air droplets are released by shaking hands, touching food with dirty hands, contact with body fluids such as blood and saliva. Symptoms. The most common symptoms are low-grade fever, dry cough, fatigue, and difficulty to breathe. The less common symptoms include recent loss of smell and taste, headache, diarrhea, and vomiting. Intraoral enanthems. These are red dots found in the soft palate area of the mouth. COVID-19 toes. These are swelling of the toes and skin rashes. Children have the same or similar symptoms to adults and are generally milder. In the first few days when I had COVID, my symptoms developed. Um, I had low grade fever, cough, colds, body ache. I couldn't stand because my legs were shaky. I knew I had COVID even if I hadn't had my swabbing yet. These are examples of oral enanthems, the red dots and the COVID toes. Severity of COVID-19 can range from mild to severe. Some may experience worsened symptoms, such as worsened shortness of breath and pneumonia, about a week after symptoms start. Older people are higher risk of serious illness from COVID-19. People who have chronic medical conditions have higher risk of COVID-19. Serious medical conditions that increase the risk of serious illnesses from COVID-19 include heart diseases such as heart failure, coronary artery disease, or cardiomyopathy, cancer, chronic obstructive pulmonary disease, type 2 diabetes, severe obesity, chronic kidney disease, sickle cell disease, weakened immune system from solid organ transplant. Remember, COVID-19 attacks the lungs. That's why patients develop pneumonia, which causes patients to cough and have difficulty of breathing. Um, with regards to the serious medical conditions, I would like to give you an example. Patients with heart failure, their heart doesn't function well or pump blood as fast as a normal heart does. So it means it has less oxygen supply to the body. When the patient catches COVID-19, the patients develop pneumonia, water in the lungs, thus also producing lesser supply of oxygen to the body, which later will cause deterioration of the body of the patient. These are other conditions which may increase the risk of serious illnesses such as asthma, liver disease, chronic lung disease such as cystic fibrosis, brain and nervous system condition, weakened immune system for bone marrow transplant, HIV or some medications, type 1 diabetes, hypertension. This list is not all inclusive. Other underlying medical conditions may increase your risk of serious illness from COVID-19. The most common COVID-19 tests. The rapid antibody-based test. Blood sample is needed. Release period is within 15 minutes. It detects antibodies formed by the body in reaction to COVID-19 infection. Okay, these are the results of the test. Negative. It means no history or past or recent or current infection of COVID. IgM positive. Presumed to have antibodies to a recent or current infection of COVID. IgG positive. Presumed to have developed antibodies due to a past infection of COVID. Patient has recovered from the disease and have no recent or current infection of COVID. This means the patient has already been treated. IgM and IgG positive presumed to have developed antibodies due to the past infection of COVID. But since an antibody at a recent or current infection of COVID is still present, presumed recovered but ineffectivity at this time cannot totally be ruled out. The real-time polymerase chain reaction test, the swab test, swab samples from the inside of the nose and the throat. Release period is within 24 to 48 hours. It detects virus genetic material. This is the most reliable test. We have free swab tests care of the local government, City Epidemiology Surveillance Unit. If you need help, you may call 096168 The Philippine Red Cross charges 3,000, or for home service it is 3,500. At Makati Medical Center they charge 8,150 for this test. There is really no way to prevent you from coming in contact with the virus, but there are steps you can take to prevent them from spreading. Here are the preventions. Number one is the vaccine, which we are still waiting for, and wear a face mask and face shield, practice social distancing 6 feet apart, avoid large events and mass gatherings. Avoid close contact with anyone who is sick or has symptoms. This is very hard to practice as Filipinos because of our culture, yung pagmamano and pagbebeso-beso. Okay. Stay home as much as possible and keep distance between yourself and others. Keep in mind that others may be asymptomatic but are infected with the virus. Wash your hands often with soap and water for at least 20 seconds, or use 70% isopropyl or ethyl alcohol. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Wash your hands immediately after. Avoid touching your eyes, nose, and mouth. Okay? Avoid eating at the same time. No sharing of food. When sick, isolate yourself. Avoid sharing plates, glasses, utensils, towels, beddings, and other household items. Clean and disinfect doorknobs, light switches, electronics, and counters daily. When sick, stay at home. Don't make travel plans yet. And always pray for safety of your family. What did I do when I got sick? I isolated myself from other members of the family. It was an ordeal for me because I didn't have Wi-Fi or TV in the room where I stayed. It was really difficult. Okay, these are examples of the prevention. The vaccine, the mask, the face shield, the isolation, and how to clean the doorknobs. Hand washing technique. Wet hands with water. Apply enough soap and cover all hand surfaces. Rub hands palm to palm, right palm over the left dorsum, interlacing with the fingers and vice versa. Palm to palm with fingers interlaced, back of fingers opposing palms with fingers interlocked, rotational rubbing of left thumb clasped in the right palm and vice versa, rotational rubbing backwards and forward with clasped fingers of the right hand and the left hand, vice versa, and then rinse with water. Dry thoroughly with a single-use towel. Use towel to turn off the faucet, and your hands are safe. Okay. Treatment for mild COVID patients. Vitamin C, 500 milligrams 2 times a day. Zinc gluconate, 70 milligrams tablet, 2 tablets 4 times a day. Azithromycin antibiotic, 500 milligrams, 1 tablet once a day for 7 days. And quarantine for 14 days. Oh, this is math. You will use math with the treatment, and with the quarantine. You will have to count the 14 days starting from day 1 of the symptoms. For severe COVID patients, go to the nearest hospital. These are examples of the medicines that we use to treat COVID-19. Please buy branded medicines. It is more effective than generic ones. Wear a face mask. It is better than wearing a ventilator. Staying in your home is better than staying in the ICU. Praying is better than complaining right now. Stay home and stay safe. That is all for today. Thank you, and please stay safe. God bless you all. Tapos na.